I'm State Representative Ben Cannon, and
I'm State Rep Chris Harker from House District 34.
we're here in Chris's office to celebrate and talk about the passage of a couple of important bills yesterday related to health care.
Bill 2116C, having received the constitutional 3/5 majority, is declared passed. House Bill 2009C, having received the constitutional majority, is declared passed.
Chris and I both serve on the health care committee. Chris is the vice chair and had a big hand in bringing these bills to fruition. We've had a good session for health care. It's going to be hard to say that about some other areas given the challenges the state faces with this budget, but we're on the verge of adding many tens of thousands of lives to the Oregon Health Plan, putting our Oregon on a path towards reducing health care costs, which is absolutely critical, and improving the health of Oregonians. So
I'll deal with a little bit of 2009, which is what I wound up talking about on the House floor, but it really sets the framework for what we think is going to be a much more efficient, accessible way of delivering health care to the people of this state. If things work out as we've planned, going to put into play, among other things, an exchange for where people will buy insurance in this state. And one of the things in there will be a public plan, which will guarantee a certain minimum coverage to those who get it. And it really sets the floor for what all of the other insurers in the state will deliver. So we're really trying to set that basic level of care that everyone in the state will have.
yeah.
What makes 2009, House Bill 2009, so important and innovative are the steps it takes towards realigning the financial incentives that drive our health care system with health.
Some of the features of 2009, this reform bill, that are most exciting to me are ones that point in the direction of changing the way that we pay for health care. We have a system now that pays for treating disease, but not a system that pays very well for preventing disease. It seems to me that we have to change the financial incentives, and the steps that this reform bill takes to begin to try to change financial incentives for doctors, for hospitals, for providers, to changing for wellness, to paying for wellness, paying for prevention, paying for disease management in a community setting and in a comprehensive setting, in a cost-effective setting, are really important if we're going to, over time, bend that cost curve, reduce the burden that healthcare costs create for businesses and individuals and government.
Yeah.
As many of you know, I'm the owner of a small business in Beaverton now. I employ 16 people and provide health care for all of them.
As everybody knows, it costs more and more each year. So I think that some of the steps we're taking in this bill and in the partner bill 2116 really are going to, over time, help bring those costs down, because the escalation that we've been on for the last several years, and right up till now anyway, are really unsustainable and a huge burden for businesses.
And one of those things that will help bring down costs, we believe, is the expansion of coverage.
We do have universal coverage in this country, and it's called the emergency room. Unacceptable. Our doctors are having to deal with the uninsured and underinsured who they see only once in the midst of medical crises. Rather than concentrating on preventative medicine, we're relying on extraordinary and therefore more expensive measures when treating these people who come into the emergency room. This cost is then passed on to us, as we have been told, if we're lucky enough to have insurance.
Covering those lives through the Oregon Health Plan, we will reduce that cost shift. We cover those lives in part by asking hospitals and insurance companies to pay a little bit of additional provider tax. We bring 100,000 new folks, including many uninsured children and low-income adults, onto the Oregon Health Plan. We reduce the cost shift. We think we ultimately help bring down rates for insurance companies and for hospitals, and we get to this goal that I know we share of towards this goal of universal coverage.
Right.
Cost containment, which we've heard so much about this morning, is impossible, in my view, without increasing coverage and reducing the cost shift. And increasing coverage will be unsustainable without reducing costs.
Oregon taxpayers send to the federal treasury tax dollars, not all of which come back to Oregon in the form of healthcare.
They're flowing out to
they're
other
flowing
states.
out to other states, and by increasing this provider tax, we're able to bring back to Oregon that $1 billion, federal dollars that are available for healthcare, as long as we're willing to put up, the state is willing to put up a smaller match.
And of course, we're able to convince them to take on this little bit of additional tax because of the recovery of the federal dollars that
That's
are
right.
going to come back in at somewhere between 1.6 and $2 per each dollar that we collect in
Yep.
taxes.
Yeah, no, it's a great deal for Oregon.
Another aspect of this that is really part of why it's a bright spot is that we're going to create an awful lot of jobs in the healthcare and health delivery and home services area. Estimates are ranging from about 3,500 to 6,000 new jobs in this area, and they're long-term, well-paying jobs.
Yeah. So your first session in the legislature got a big hand in helping shape this healthcare legislation. What did you think of the process?
A mind-boggling process. Ironically, now at the end of the session, I feel like I'm prepared to begin one really well. So, I said from the beginning that my hope was that we would pull this off in this session in spite of the financial crisis that we're in, really, at the national and state level, and that this would be one of the bright spots in a fairly dreary time. And right now, I'm feeling like we're
Yeah.
pulling it off.
Yeah.
It's good.
All right. Good work, Chris.
Likewise.
Thanks.